In today's video, we're going to find out what happens if a bee stings you. Do you need to panic? Do you need to be okay? What are the first things that you should do if a bee manages to sting you? That's what we'll be answering in today's video, so make sure to watch it till the end. And don't forget to subscribe for more amazing videos. Bees can sting you for different reasons. They might feel threatened or sense danger, or they just might feel like stinging you for no reason at all. Whatever the reason is, there are some things that you should know about bee stings and how to deal with them. One of the first things you should know is whether or not the bee is a honeybee or an Africanized honeybee, because that will determine how many times they can sting you before they die. Honeybees are your average bees that you normally see in the wild or even in your own backyard. These are the bees that live in hives and produce honey. They typically have a smooth stinger without any barbs on them. If a honeybee stings you, then chances are they won't be able to sting you again because their stinger is smooth and will come right out of your skin. This means that the bee can only sting you once and then it dies. However, there are some cases where a honeybee has managed to sting someone multiple times. It's rare but not impossible. Now, on the other hand, we have the Africanized honeybee, which is also known as the killer bee. These bees are actually a hybrid between the Western honeybee and the Africanized bee. The killer bee was brought into the U.S. in the 1990s from Africa for its hardiness against mites. But little did anyone know that these bees would become aggressive and dangerous. As opposed to the Western honeybee, the Africanized bee has a barbed stinger that hooks into your skin and tears away when you try to pull it off. This means that the bee can sting you multiple times, and each one of those stings will be very painful. There was even one case where a woman was stung by an Africanized bee over 1,000 times. So if you ever encounter one of these bees, try your best to stay calm and move away slowly. Don't run, because that will only aggravate the situation. Another thing that you should know is what kind of pain you can expect from a bee sting. Bee stings are said to be one of the most painful things that can happen to a person. And although it depends on the type of bee that stings you and where on your body you get stung, here's what you can generally expect. When a bee stings you, you'll immediately feel a sharp, intense pain that can sometimes even feel burning hot. This is because the bee injects venom into your skin. For most people, this pain can last anywhere from a few minutes to an hour, but for others, it can last for several hours or even days. The pain from a bee sting can also vary depending on where you're stung. For example, getting stung on the face or neck will be more painful than getting stung on the arm or leg. This is because there are more nerve endings on your face and neck than on your arms and legs. Additionally, if the sting occurs near a joint, the pain may be more intense. This is due to the fact that joints contain more sensitive nerves than other areas of the body. Lastly, if you're allergic to bee stings, the pain may be even worse for you. In some cases, the pain can be so unbearable that it requires medical attention. Now let's talk about what you should do after getting stung by a bee. The first thing you should do is to remove the stinger if it's still in your skin. To do this, you can either pluck the stinger off with tweezers or use a credit card to scrape it off. Avoid using tweezers if the stinger has broken off inside your skin. Instead, you'll have to leave it alone until it heals on its own. After removing the stinger, wash your hands thoroughly with cold, soapy water. This will help to remove any bacteria that may have entered your skin. Along with the stinger, you should also apply a cold compress to the sting site to help reduce swelling and pain. You can do this by wrapping ice cubes in a towel or using a cold pack from the freezer. Another thing you can do is take over-the-counter pain medication such as ibuprofen or acetaminophen. These medications can help to alleviate the pain and inflammation caused by the bee sting. Make sure to follow the directions on the label and do not exceed the recommended dosage. If you're unsure about taking any medication, consult with a healthcare professional. If the pain is unbearable or persists for more than a few days, you should seek medical attention. A healthcare professional can provide a local anesthetic to numb the area and may prescribe stronger pain medication if necessary. It's important to note that not everyone is allergic to bee stings. However, if you're not sure whether or not you're allergic, it's always best to err on the side of caution and seek medical attention. If you're allergic to bee stings, the reaction can be severe and life-threatening. Symptoms of an allergic reaction can include difficulty breathing, swelling of the face, lips or tongue, and a rapid drop in blood pressure. If you experience any of these symptoms, seek emergency medical attention immediately. If you aren't allergic to bee stings, the pain will eventually go away on its own. However, there are some things you can do to speed up the healing process. One is to apply a topical antibiotic ointment to the sting site. This will help prevent infection and promote healing. Another thing you can do is to wear loose clothing over the sting area. This will help reduce irritation and allow the skin to breathe. Finally, you should avoid scratching the sting area as this can lead to infection and further pain. If you're concerned about the appearance of the sting, you're not alone. Many people worry about the size and color of the resulting bump or blister. However, it is important to remember that this is a normal part of the healing process and will eventually go away on its own. Typically, the bump or blister caused by a bee sting will disappear within a week or two. However, if it persists for longer than this, you should seek medical attention. Although bee stings are not typically associated with serious infections, it is possible for the area around the sting to become infected. Signs of an infection can include redness, swelling, warmth, and pain at the sting site. If you notice any signs of infection, you should seek medical attention promptly. A healthcare professional can examine the area and prescribe antibiotics if necessary. In conclusion, being stung by a bee can be a painful and scary experience, but it's important to remain calm and take the appropriate steps to ensure proper healing. By following the tips outlined in this video, you can minimize the pain, swelling, and risk of infection associated with bee stings. Remember to remove the stinger, clean the wound, apply a cold compress, and take over-the-counter pain medication if needed. If you're allergic to bee stings or experience severe pain, swelling, or difficulty breathing, seek medical attention immediately. With proper care, most bee stings will heal on their own within a week or two. However, if you're concerned about the appearance or healing process of your bee sting, don't hesitate to consult a healthcare professional. We hope you found this video helpful. If you did, please hit the like button and share it with your friends. And if you haven't already, make sure to subscribe for more informative and entertaining videos. Thanks for watching, and we'll see you next time.